The SP4FP is the acronym for the project. The full meaning is actually Nigerian State-led Strategic Purchasing for Family Planning and Maternal, Newborn and Child Health project. It's a Bill and Melinda Gates funded project. The project was developed as an output of engagement primarily with the Lagos state government around the need to support them to properly operationalize their health insurance scheme in a way that impacts on primary health care and specifically also family planning as an area which the foundation, the Bill and Melinda Gates Foundation, and the Lagos state government are particularly interested in. The foundation conceived the idea of the strategic purchasing for family planning and MNCH services. After the initial concept approached us as one of the local partners who have been active in the space of sustainable health financing for health and primary health care. And then from that concept, we now co-developed the project. Now, the project has 4 critical components. The first one is around building the capacity of government, the government institutions and the individuals who lead and work with those institutions to be able to improve on the design and implementation of the health insurance package, the mechanisms for quality assurance. It was to support those institutions like LASHMA in Lagos that is responsible for the health insurance, HEFAMA in Lagos that is responsible for hospital accreditation and continuous monitoring to ensure that they have the right capabilities, processes, systems to be able to deliver.
We had a newly elected board and they provided capacity building for not just the staff across the various levels, whether it's medium, junior, middle level, etc. But they also supported the board in giving them orientation and also like a board policy manual that would guide how they conduct themselves in implementing the mandate that they were given.
One of the things that was good in the collaboration is that they have been good partners to us in LASHMA right from the beginning, and also in trying to bring up the staff to speed. One of the things that is quite relevant, which they have done, is that they have gone across board, across departments to be able to train people, both on the operations and also the technical issues. They've also organized a lot of forums where they've educated the staff and the departments on the operations of health insurance generally in Nigeria. I know at some time they also took some senior management staff of LASHMA to Rwanda to go and actually see what is being done in other African countries. And this has actually helped LASHMA because LASHMA happens to be the first that signed their law, and it was a testing ground for them. And you find out that there were a lot of things that they need to learn. And in that learning process, they needed the expertise of SP4FP through HSCL to be able to guide them.
The project actually supported us seriously. Like, it's supported in the aspect of the technical assistance plan. It serves as a guide to the agency, knowing where our weaknesses are, so that this gap that is there can be bridged up to.
The years when the agency just started building its capacity, it was necessary for us to have someone who understood the compliance space and who had enough knowledge in quality to help us articulate some of our processes and procedures. And they were able to provide support to the agency by embedding a technical assistant in the agency. Health Systems Consult Limited also supported us to carry out a quality assessment, quality improvement landscape in Lagos State. And in 2021, they supported the agency in articulating our standards And HSCL also supported us to articulate our 5-year strategic plan. HSCL supported the agency to onboard our board members. They went through capacity building so that they had a plan and a direction, and they were able to adequately identify the direction in which the agency needs to put our efforts so that we're able to achieve our mandate.
Like for me, I worked at the State Primary Healthcare Development Agency. There are some that work at the secondary healthcare facilities, primary healthcare centers. And by being in that agency, we are all new to that agency, and we don't have what it takes to do the activities or to deliver the mandate of the agency. So BMGDF seriously played a very important role in building our capacity in respect to how do we manage our clients. This gap analysis, what does this department really make, and what impact will they make in this aspect? They help us in respect to developing our organogram, and what do we really need in that agency, and how do we go about it to build our capacity.
In 2020, early 2020, during our inception plan, we thought of having a scoping assessment to deep dive, to understand, so that the agency will start in a more strategic pathway. And that is when we reached out to the Bill and Melinda Gates Foundation. And then the BMGF also graciously approved our request. And I think through that support, we have hugely benefited, because we have worked to identify and assess gaps in a regulatory framework for the design of the scheme. We work with HSCL to also assess the status and capacity of the agency before takeoff. And some other very important milestone that was achieved. A comprehensive TA plan was developed. They supported us to develop even our M&A framework. They also supported us to have some capacity development for the agency on key insurance functions. They also supported us to develop some key strategic documents, including, of course, other issues around organizational structure.
We also conducted a health facility assessment in year 2021. This was actually done in the heat of COVID, but plans have been going on to conduct that. And so we had to introduce a new approach whereby the assessment was conducted virtually. We had a whole great support from EFAMA, being the agency in charge of health facilities in the state. They worked with us so much on this. We were able to first clean up the database of health facilities in Lagos State. Assessment was conducted successfully.
Health Systems Consult Limited supported the state in the health facility assessment, in trying to get the different types of health facilities and the services that we're providing as a state. They also supported the state in carrying out an audit, and they also supported us in building the capacity of our staff.
Over 1,600 facilities were assessed in Lagos. And I also need to mention that this health facility assessment was also conducted in Bauchi State, where over 670 facilities were assessed.
They really supported us in respect to mapping of the health facilities, where series of accreditation has been conducted. That's based on the political words we have. So it really helps us in knowing the facilities based on the assessment conducted.
So when the project was starting out, it also had part of its objectives or its deliverables to have family planning integrated into that existing health benefit package, which had only FP counseling in it. And so the project embarked on that process to get family planning integrated. It was a very collaborative process, working with all the key stakeholders, LASHMA, the SMOH, private providers, associations, and all the relevant people.
And so we have the benefit package from Lagos State Health Scheme, but within that benefit package was only consultation for family planning services, meaning that if you were registered on the scheme, you could go into a facility, public or private, depending on who you decide. You could have family planning, but it stopped only at counseling. So if you had gone in that day and you were counseled and you had made up your mind and you wanted to access service, meaning you had identified the method you wanted and you wanted to take up that method that day, you couldn't do that. you had to go somewhere else. There was that fear of, could we offer this service without altering the premium package?
After 3-4 years intensive work with the state government, a lot of advocacy, the state saw the need and became the first state in Nigeria to fully integrate family planning services into its health insurance benefit package. And the governor launched this 2 years ago. Other states are now beginning to pick up from that. And not only were they able to integrate family planning, we were also able to work with them to bring in other aspects of HIV/TB that was missing from the package. And they also even expanded to include oncology services for the treatment of cancer. So that's the biggest win for us, because that's the essence of all this work. So people who have health insurance in Lagos now, the women who need family planning are able to access family planning, and it's covered, it's paid for under the health insurance scheme. So for me, that's the biggest win, and that was the overall goal of the project. And we're able to achieve that in the 4th year of the project.
The SP4FP project was able to help LASHMA to review the existing M&E plan, which was not so robust at that point. Not only did they help us review it, they were able to also help us to print it out into documents where we could have people have their own copies. And at the end of the day, we had some thematic areas that were able to monitor our performance as an agency. Not only monitor the performance, but also to measure how well we are doing as an agency. And the SP4FP didn't stop at doing this for us. They also supported us at our maiden performance review meeting, where we're able to pick each and every thematic area in the plan and see what our performance was like. And the M&E plan has also helped us as an agency to make decisions.
The second component was around creating demand for these services, primary health care services, family planning as a specific marker of uptake of those services, and also creating demand for the insurance itself, so that people are aware, that these insurance schemes work, what the benefit packages are, and where they can access services, and the kind of quality they should expect, and also how to provide feedback on how satisfied or not they are with the services and the system.
CCSI brought its expertise in SPC into the consortium of the Strategic Purchasing for Family Planning project. CCSI's role was to generate demand and encourage them to understand the benefits of purchasing the state health insurance scheme through the understanding of social solidarity. So our branding was wrapped around social solidarity, and we provided information around the benefits of the health scheme. And I could remember that the 3 key benefits were around equal access, affordability, and most importantly, the quality of care they could get. Through a co-creation approach, including all other stakeholders, we developed a coherent communication strategy, and this included elements of social mobilization, mass media, community enrollment that encouraged the people to understand the benefits of the scheme so that they could enroll and participate.
We brought in the informal sector, the artisans, the barbers, the mechanics. We brought them together and we told them about this. And then we asked them, how do you want us to actually bring this to you? And they were actually surprised that they were being brought on board from the inception. They were surprised about this.
We intensified community mobilization, like I said, and we developed some packages on radio, very innovative radio programs, jingles, using some drama sketches, some elements of entertainment education, just to bring them to the same understanding as to what the government really intends to do to provide access to universal health coverage.
Clearly, the FP4FP project has been able to support demand generation to a very reasonable extent. Foremost is in helping to support for radio jingles. I'm proud to say today that quite a large number of people enrolling on the Eco plan heard about the Eco plan through these radio jingles that the FP4FP project has been able to support.
We went on one of the most popular radio stations in Lagos and the most popular radio program in Lagos to be able to reach out to people. First, about awareness. A lot of people are not aware. Even those who are aware felt like, oh, it is an elitist thing. It's one of those highfalutin things that government has brought for themselves. We had a magazine program where we brought in experts who are able to answer the question of the people. They have so many germane questions. They are wondering, how is this going to work out? Maybe they have issues with a particular hospital health providers. They were able to ask questions, and then we had experts on the radio stations who were able to give them the right answer.
We've also been able to support strategic engagements like retreats. We had one in Ekpe where we were able to conceive some of the contents and narrative we'd like to push to the public. It was even there that we defined how we describe Ilera Eko in terms of messaging in Yoruba to residents. In terms of IEC materials, the SP4 EPIC projects has been able to support T-shirts, brand items with signature logos to give Ilera Eko visibility, which is very, very important within Lagos. Face caps, T-shirts, flyers, and a lot more. And from time to time, the SP4 EPIC project also supports a lot of what we call sales clinic to reinforce this kind of training you must have given to your salespeople, such that those training are not wasted, and you can see that they are actively resonating with the techniques and the know-how that you probably taught them on how to deal with the public and individual when it comes to insurance pitches.
The workstream on provider readiness implemented by Insight Health Consulting focused majorly on private providers, trying to get them up to the required standard for empanelment into the Lagos State Health Scheme.
Because the state health insurance schemes by name and definition are state-led, typically, you find that they start with public facilities and they first enroll civil servants, right? But we know from several assessments in Nigeria that over 60% of Nigerians actually access care in the private sector and not in the public sector. So if you really want to be able to provide care to all the people, you need to make sure that the places where they access care are on board. So that support to the private sector to make sure that they meet the requirements, they understand the requirements for becoming part of the health insurance program, which we call empanelment. And eventually they meet the criteria for empanelment, and then we support the state institutions to now assess and empanel them so that a lot more facilities are on board.
As the organization responsible for managing the provider readiness aspect of this project, part of the things we did was, one, to conduct a baseline assessment so that we can understand the current situation of these private facilities that we want to work with. And we then develop a quality improvement plan that will speak to each specific facility based on what we found out during the baseline assessment. And then after that, we then use this quality improvement plan to help these facilities to take them from where they were to where we want them to be so that they can be empanelable on the Lagos State Health Insurance Scheme. And we help these facilities to put in place a quality improvement team that will manage the plan that was developed for them. And this quality improvement team ensures that everything outlined in the plan are fulfilled. And again, we provide trainings for these facilities based on their needs. There are some we give financial management training. Every one of them, we did infection prevention and control training. We did business of health insurance training for all of the facilities so that they will understand what health insurance is all about. We also conducted waste management training for them and also quality improvement training. We also linked them up with private family planning provider organizations like DKT, where they have access to procurement of commodities at a discounted fee. And also they were able to receive professional training on how to, administer all of these family planning methods. Through our project, we have been able to improve the communication between private facilities and a farmer. That is the body managing private facilities or facility registration in Lagos State.
IHC, that was the Insight Health Consulting, came to our facilities. And then once we heard that it was about quality improvement, we embraced them. During the period, we were supported with training on management of health insurance, quality improvement program. We were actually encouraged to form a quality improvement team that comprises of the medical director, the matron, the most senior nurse, and the administrative officer. And we meet regularly, say every month, to discuss how to improve quality in the facility. Quality in terms of our services, quality in terms of our equipment, and quality in terms of staff. The other thing they did was in their panel met with Lagos State Health Scheme. Initially, when the Lagos State Health Scheme came up, I was one of those who rejected it outrightly. But when IHC came in, I was sort of encouraged to join again. And I was taken through the process of registration. And to the glory of God, we were paneled about 3 or 4 months ago through the help of IHC.
SP4FP has really helped us in the facility a lot. It's our finance, it's our structure, our modus operandi, and the prevention of infection and so many other things. The essence of what they have done in totality is just to really make sure that we have standards that cannot be questioned by anybody.
They've been able to take us through all the processes. We've had quite a number of training. Some of our staffs were trained on quality improvement, the financial parts of the hospital, managing the enrollee, and they've taken us all through those processes, helping us even get registered under LASHMA. Though getting ourselves registered, the process was very tedious, but thanks to Insight Consulting, who made it very easy for us because they practically took me by my hand and took me all through that process till I was done with that registration.
Many thanks to SP4FP projects, especially through Insight. We've learned and gained a lot from the projects. I think they first of all came some few years ago. They made an assessment of the hospital and they graded us. Thereafter, they empaneled us, they enlisted us into the program, and they brought in our staffs, which they trained a lot of capacity building, like financial management training, infection management programs, and they also carried us along on how to enroll in Lagos State LASHMA programs.
The SP4FP program has been of immense benefit to the agency. We have collaborated with the partners in the consortium, HSCL and Insight Health, to visit health facilities in Lagos State. Most of these health facilities that were unable to meet our basic criteria for registration and accreditation before, we have visited them, and our visit have resulted in the improvement of their standards. And most of these facilities are able to meet our requirements for registration and accreditation after those visits. There has been good improvement in the quality of care in these health facilities as a result of the SP4FP program. And this has greatly helped in the improvement in the quality of care delivered to residents of Lagos State by these health facilities.
The last one is around research, because data is everything. Operations research. What have we learned from other states, other climes, especially those with similar settings like Nigeria within and outside Africa, right? And what are we also sharing from our experiences? How do we make sure that as we work with the states, we also harvest data, we document our challenges, our achievements, the lessons learned, and put them out in platforms where the rest of Nigeria and the world can see and learn from what we're doing.
The work stream on operations research and knowledge management implemented by HPRG Health Policy Research Group conducted research which seeks to generate evidence on the effectiveness, efficiency, scalability, and sustainability of the Lagos State Health Scheme for achieving universal health coverage.
So our job was undertaking research to show how effective the implementation of the project has been, and then by itself and also by improving the overall performance of the Hilarious Code program. So it was what we call co-produced research with the implementers. I mean, right from onboarding, everybody was involved, to data collection itself, both HSCL and LASHMA, the operator of Hilarious Code were involved. We had data analysis workshop, we had capacity building, where the capacities of people from LASHMA were built on analyzing data, and then we analyzed jointly, and then we had a joint also validation of the results, so that there's ownership of the findings. So I think these are what we did with very close involvement of LASHMA and HSCL. I think the key findings that 18% of respondents were enrolled, which is quite high. The national coverage for health insurance is about 10%. So to find out 18% of people were enrolled in the state was quite high. But I think the striking thing about this result is that half of these 18%, so about 9% of them were from the informal sector. I mean, Nigeria, we're always struggling to enroll the informal sector in health insurance. So to find this high number is quite interesting. But I think what was really exciting for me was that 86% of respondents were actually willing to be enrolled in the scheme. I mean, most of them didn't know they existed. 86% is a very large number. Who say they were willing to enroll. I mean, if 50% actually paid to enroll, that's a massive number. We found out that this component by HSCL, it actually increased the uptake of family planning by 14% from the initial number. And it was a very significant increase, in the uptake of family planning in the state. So they think the project has made an impact. So it increased it by 14% and actually increased overall use of maternal and child health care by 4%. And something that insurance does is to reduce the level of out-of-pocket spending. So we found out that the scheme by the HSCL reduced out-of-pocket payment by 28% on the average. So that's a massive number of reduction in out-of-pocket spending. And the project was overall efficient because when we computed the cost to benefit ratio, the benefits far outweigh the cost of the intervention. So the benefit cost ratio was 1.57. So if it's positive like that, it means the benefit outweighed the cost. So in economic terms, we'll say, this intervention should just continue because the benefit outweighed the cost.
One of the things that we suffer in this climate is people's acceptability to government-run programs. The first thing for them is, it will never work. The interesting thing is that the Lagos State Health Scheme is a different story. The challenge about the people's belief, the perception about the insurance scheme alone was a major challenge.
At that time, understanding and appreciating the concept of social and health insurance was a bit difficult and tough.
A lot of the healthcare providers didn't really also believe in this insurance scheme. They felt it was some charade, was a wash, and so some of them had to pull back. But there were a whole lot around sensitization. It will interest us to know that the peak of our implementation was the COVID. And as part of what we do in HSCL, we had to be innovative again on how to implement in the peak of the pandemic.
That period was a trying period. Working with the state Lagos was pretty innovative. They started a co-telemed where, you could now get teleconsultations. So you didn't need to come to the hospital and the health workers did not need to go to you. Lagos and the other states we worked with, Lagos Yobe and Bauchi, also did really well in providing a lot of orientation to health workers, providing them with personal protective equipment, to make them feel safe to continue to see patients. In Lagos, for instance, we were one of those who also donated PPEs, again, just to improve the safety for the healthcare workers.
We cherish this very important project because it came at a time when we needed it the most, particularly at our inception period, because the scoping assessment that was conducted and some of the key strategic document that was developed has greatly supported the agency for better inception, including better targeting and better strategic direction. So this is one thing that we cherish about the project, and we sincerely thank the implementers, the HSCL, and the donors, the Bill and Melinda Gates Foundation.
In terms of if the project has been able to achieve its set objectives, spanning from main beneficiary Lagos State to Bauchi to Yobe. I would say it's yes, along with our funder, the Bill and Melinda Gates Foundation, a very big thanks to them. We had set indicators across each of the work streams. Beyond just improving capacity, we also wanted to increase the numbers of enrollment. We also wanted to see how the private providers available for accreditations were increased. And the biggest of all was the full integration of the family planning. If we check across all of these indicators, they were all ticked, well ticked.